All right, let's dive into one of the NCLEX's absolute favorite high-risk medications, lithium. My goal for you is simple. By the end of this, you're going to master this drug so you can walk into your exam and crush any safety or clinical judgment question they throw at you. Let's get into it.
So, first things first, why? Why is the NCLEX so obsessed with this one drug? What makes it such a big deal? If you can really get the why behind it, I promise you every other detail is going to click into place so much easier.
And boom, here it is. This is the answer. It's all about that razor-thin line, that tiny little space between a dose that actually helps the patient and a dose that can be incredibly harmful. This one concept, this narrow therapeutic window, is the key to unlocking basically every safety question about lithium.
So here's our game plan for today. We're going to cover the basics. Then we'll memorize the numbers you absolutely have to know. We'll figure out how to spot the difference between an expected side effect and a full-blown toxic sign, get into the triggers, lock down our nursing priorities, and then we'll put it all together with a classic NCLEX scenario.
Okay, Section 1. Let's build our foundation. So what is this stuff, and why do we even use it? So at its core, lithium is a mood stabilizer. We use it to treat those manic episodes in bipolar disorder. But here's the real core idea for the NCLEX. Don't get bogged down in the super complex mechanism. The exam wants you to know that your patient's labs and their fluid status are way more important than the dose itself. That right there is the heart of patient safety with this drug.
And here we are. This is probably the most critical part of this entire review. Seriously, if you only remember one thing, make it these numbers. They are completely non-negotiable for the NCLEX. You have to know them.
Here it is. Write this down, tattoo it on your brain, whatever you have to do. The maintenance therapeutic range for lithium is 0.6 to 1.2. This is the sweet spot. This is the safe and effective zone we are shooting for.
And this is the danger zone. Any level that hits 1.5 or goes above it is considered toxic. And I don't mean that's a warning sign, I mean that is a full-blown 5-alarm medical emergency. When you see a level of 1.5 or higher on your exam, that's your cue to take immediate action.
This table puts it all into context. You can see that, yeah, for acute mania, a provider might push that level a little bit higher, maybe up to 1.5. But for you, for the NCLEX, the takeaway is crystal clear. 1.5 is the absolute ceiling. The second you see that number, your brain needs to be screaming toxicity.
Oh, and here is a fantastic NCLEX pearl they love to test. Lithium is slow. It takes 1 to 3 weeks to really start working. What does that mean for you? It means it is never the right choice for a patient who is acutely agitated right now. For that, you're going to use a rapid-acting antipsychotic, not lithium.
All right, Section 3. This is where your clinical judgment really comes into play. The next-gen NCLEX is all about recognizing cues. Can you spot the difference between something that's just an expected side effect versus a sign that a crisis is right around the corner?
This right here is a classic NCLEX rule. A fine hand tremor, that's expected. It's a common side effect. Your job? Document it and keep an eye on it. But a coarse tremor? Whoa, that's a huge red flag for toxicity. Your priority action is to hold the drug and call the provider. So remember, fine is okay, coarse is a crisis.
Now, when that level climbs above 2.0, we are in really deep trouble. The central nervous system gets hit hard. You start seeing ataxia, that clumsy, uncoordinated movement. Plus confusion, slurred speech. These are late-stage, life-threatening signs that things have gone very, very wrong.
So, you might be wondering, how does this even happen? How can a patient who was on a stable dose yesterday suddenly become toxic today? Well, this next section covers the exact triggers and interactions that can push a safe level right into the danger zone, and this is a huge topic for the NCLEX. Just remember these 4 Ds: dehydration, decreased sodium, diuretics, and certain drugs. See, the kidneys, well, they aren't that smart. They can't really tell the difference between sodium and lithium. So if your body is low on sodium or dehydrated, the kidneys get desperate and hold on to whatever they can. And that includes lithium, causing those levels to just skyrocket.
And you have to know this drug interaction. NSAIDs like ibuprofen and naproxen are tough on the kidneys, and they absolutely increase lithium levels. So if your patient on lithium needs something for pain, they need to be taught to always choose acetaminophen. This is such a common safety question.
Okay, so we've got the knowledge down. Now let's pivot to action. What do you actually do? As the nurse, what are your priorities to keep your patient on lithium safe? Think of this as your pre-flight safety check before you even think about giving a dose of lithium. First, what's their latest lithium level? Second, what's their hydration status looking like? Any vomiting or diarrhea? And third, how are those kidneys doing? Check the BUN and creatinine. If you see a red flag in any of these three, you stop and you reassess before you give that pill.
And remember, patient teaching is patient safety. These points are totally non-negotiable. 2 to 3 liters of fluid a day. Keep your salt intake consistent, no NSAIDs for pain, and call the provider right away if you have vomiting or diarrhea. And make sure you emphasize that they need even more fluids when it's hot out or if they're exercising.
Okay, it's the final section. We've learned the facts, the numbers, the priorities. Now it's time to apply everything to a classic NCLEX style safety scenario. Let's do this.
Okay, let's break this down. Let's recognize the cues. Our client is on lithium. They're reporting vomiting and diarrhea. Ding, 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 that's a huge dehydration risk. They have coarse hand tremors, another major toxicity sign. And the lab confirms it all. Their level is 1.7, which is well over that 1.5 toxic line.
So, you've seen the cues, you've analyzed the situation, the alarm bells are ringing. Now you have to prioritize. What is the single most important first thing you are going to do?
This is it. This is the only correct priority action. You never, ever give more of a drug that is already poisoning your patient. Your first job is to stop the harm. That means holding the medication. And then you immediately escalate to the provider. This is a medical emergency, plain and simple.
And finally, let's just quickly review the top NCLEX traps they want you to fall into. They'll try to see if you'll just dismiss a coarse tremor as no big deal. They'll give you an option to give ibuprofen for pain. They might even suggest a low-sodium diet. They'll test to see if you ignore vomiting or diarrhea. Your job is to spot these traps from a mile away and always, always choose the safest action.
So, here is your final takeaway. Burn this sentence into your brain for exam day. Lithium saves moods, but fluids, sodium, and the kidneys decide its safety. If you can master that one concept, you will master every single lithium question on the NCLEX. You've got this. Good luck.